This video will guide you through the process of recording when you've issued a kit to an eligible patient during a consultation. Through the Alternative Access to Kits model, healthcare providers can bulk order free bowel cancer screening test kits, known as IFOBT or FOBT kits, and issue them to eligible patients during an appointment. Talking to a healthcare provider can be key in helping people decide to do the bowel screening test, and could help increase low screening rates in some community groups. If your clinical software is integrated with the NCSR, you can also complete this process there. For more information, visit ncsr.gov.au/integrations. You've had a chat with your patient about completing the bowel cancer screening test and will be giving them a kit to take home. It's important to complete the following steps to ensure the samples can be tested and the results sent to the correct address. First, check that your patient is eligible for the bowel screening program and hasn't screened in the last 2 years, and that their contact details are correct and make any necessary changes. Then complete the bowel kit issued by healthcare provider form to generate a unique pre-populated participant details form. Then print a copy of the participant details form and give it to your patient to sign and include with their samples in the reply paid envelope, which is enclosed with the kit. To record that you've issued a kit, first search for your patient, and from within their bowel record, in the Forms tab, click Choose a Form. Then select the Bowel Kit Issued by Healthcare Provider form. Please note that this form will only display if your patient hasn't screened in the last 2 years and is eligible to receive a kit. Next, select a reason for issuing the kit. The system identifies by postcode whether your patient lives in a region where the average monthly temperature is currently over 30 degrees Celsius. Samples need to be kept cool for as long as possible, and exposure to high heat can affect test results. It's recommended to issue the kits to patients during cooler months, but this can be a judgment call by the issuing healthcare provider if they see a clinical benefit. Enter the date you issued the kit and its expiry, found on the back of the kit. The nominated healthcare provider will receive a copy of your patient's results. If a provider is already recorded against your patient's NCSR record, their details will display here. Otherwise, the details of the healthcare provider filling in the form will display. Use the provider lookup if you'd like to nominate a different healthcare provider. Then provide confirmation that your patient has given consent to receive this kit from you. Next, review the form, then click Submit to generate a pre-populated participant details form. Print the form, give it to your patient, and remind them to enter the dates the samples were taken, sign the form, and include it in the prepaid envelope when they send back their samples. Once you submit the form, an icon will display the patient's bowel record. This will inform other healthcare providers that this person has received a kit via the Alternative Access to Kits model for this screening round. To assist you with patient follow-up, go to the My Correspondence tab to see if their test result is displaying or is inconclusive. If you don't see a result or it is inconclusive, it's a prompt for you to get in touch with your patient and encourage them to either return the completed test kit or complete a new test. To find out more about the National Bowel Cancer Screening Program and Alternative Access to Kits model, visit Health.gov.au/NBCSP.